Good evening. Good evening. My name is Robert. Thank you so much for joining us. We've been doing this for the last 3 weeks. And today we will be talking about the silent killer. We started obviously with complications, and we've been emphasizing that we're doing that for a reason. And the reason being that if you can understand how the silent killer, and we talk about the silent killer, we're talking about high blood pressure or hypertension. We started with the complications because if you can understand how high blood pressure can silently kill you, then you'll be able to take it seriously. And today we're going to be looking at what is high blood pressure and what are the numbers that tells you that you have high blood pressure. Because the emphasis here is that high blood pressure is not gonna you're not gonna have symptoms, and but some of the things that will start happening if you're having symptoms is when things internally have been damaged, whether it's your brain, your heart, your kidneys, or your legs, or any part, where the blood vessels reach, which is every part of your body, then you're going to be having issues. And those are the symptoms that will be telling us that you've had high blood pressure for a long time. So the best thing is to actually know what is your blood pressure. And like I said in the beginning, if something is described to be high, that means there is normal and there is low. So the questions, one of the things I would say, why do I have the passion to teach about high blood pressure? And the passion is because I started my career in cardiothoracic ICU, and that's where you operate, people get operated, their hearts get operated so that they can fix the pipes that got clogged or damaged because of high blood pressure and diabetes. And I realized the easiest thing is to tell people that just how dangerous blood pressure can be and how dangerous diabetes can be. And so we'll start with, again, asking what is high blood pressure. And I say that's what we will end with when it comes to this series of the silent killer. And so again, it's called high blood pressure, hypertension, or the silent killer. And let's talk about blood pressure. Is the force, the long-term force that your blood vessels, and I've been calling them the pipes, experiences, from experiences. And there's a way that we measure that. And one of the things that is going to be contributing to blood pressure is the amount of blood that the heart pumps, or the resistance that the blood gets as it flows through the pipe. And that's basically as a result of either the pipes are narrow, or or there's things clogging the pipe, and that's going to determine how well the blood flows within the pipes, the blood vessels. And so that simply is what blood pressure is that force that is experienced by the blood vessels walls, and there's a way we measure it, and we measure it either using an automatic blood pressure machine or a manual one, and the healthcare provider is trained on how to take the blood pressure in a manual way. And these are the numbers. When we talk about high blood pressure, and if you notice here, it's codified in terms of color. There is normal blood pressure. It should be less than 120/80. And previously I explained to you that, don't get entangled by these numbers. There's a top one and there's a bottom one. And I told you the top one is when the heart is squeezing, and the bottom one is when the heart is resting, because the heart is always squeezing and is resting. So the top one is when the pressure on the blood vessels when the heart is squeezing, and when it is, and the bottom one is when it's resting. And so it should be less, and we go to the screen here. It should be, normal blood pressure should be less than 120/80. And obviously if it's too low, that could be a problem, but we are focusing on high blood pressure. Notice when you start going above 120, there is a new categorization, and 120 to 129, that's considered elevated. And when you start getting to stage, 130 to 139, the top one, or 80/89, 80 to 89, the bottom one, then basically stage 1 hypertension or high blood pressure. And definitely you have high blood pressure if it's above 140. And when you start getting to 180, and higher than 120, the bottom one, basically you are in what we call hypertensive crisis. And this is why you'll have somebody going to the hospital, and obviously the first thing in any clinical hospital they will do is take your vital signs, including your blood pressure, and they will be told, oh, you need to be admitted to ICU. And they're like, no, I walked myself here, I don't have any pain, I don't have any problem. And they'll be told, no, you're supposed to go to ICU, because if you don't, basically you can end up having a stroke, and right there you'll have a permanent damage to your brain that can never be reversed. Or and so they're danger. So basically it's a dangerous thing. That's what you say. And actually this is the point where you realize the blood pressure can actually be a silent killer, because you go to the hospital and they tell you you're okay, and you're thinking you're okay, and you had gone there for different reasons, and they take your blood pressure and they tell you, no, you're supposed to be admitted to ICU. And if you don't, you could go and basically have such a massive stroke that you don't even survive. So this is why it's important to actually mark this number. Again, if you have high blood pressure, it will be anywhere from 130 to 140 and higher. And when it gets to over 180, in a hypertensive crisis, and you have to be admitted in a setting that will bring down that blood pressure in a way that doesn't pop some pipes in your brain or somewhere else, and you end up having permanent disability for something that can actually be prevented or controlled or reversed. And that's really what we've been focusing on, is that it's not something that there's nothing you can do something about. You can control it if you have it. You can reverse it again with your healthcare provider, and you can prevent it if you don't have it. Doesn't mean that permanently that you if you don't have blood pressure today, doesn't mean you may not have it next year or 2 years from now. Why? Because there's certain things that you could be doing that could make you develop high blood pressure. And so we'll move on to how do you accurately measure blood pressure, because there are things that can inaccurately give you wrong readings, and that is what we're going to be discussing. So when you're having high blood pressure taken, one thing that you should make sure is that you're sitting upright like I am, and your back is supported and you're sitting upright. Your legs should not be crossed. They should be sitting flat on the floor. And when they're taking your blood pressure, the cuff should be at the level of your heart, and there is an arrow there, and I know also that you may be having healthcare providers who are listening, and the arrow should be pointing directly on the on the cuff, should be pointing on the brachial artery, and they're trying to know where that is, and it should be the right size, because sometimes people will take blood pressure with the wrong cuff, either it's too big or too small. That's going to give you inaccurate blood pressure reading. Very important to know that your bladder should be empty, meaning that you should have voided or gone number one or urinated before you take blood pressure, because if your bladder is full, that will influence the blood pressure and could give you wrong reading. And what I actually really need you to remember is that you should rest for about 5 minutes first before you take blood pressure, because if if somebody tells you have high blood pressure, you just been running and they took your blood pressure, they tell you have high blood pressure, I mean that would be wrong, because you should have rested for at least 5 minutes. And it is important to let your healthcare provider know that you're either on certain cold remedies, meaning common cold medications. There are medications that could raise your blood pressure as you're taking them, but not necessarily that you have high blood pressure, but because you're on certain medications. It's important to let your healthcare provider know what medications you're taking, or you've taken caffeine, energy drinks that have caffeine, will temporarily raise your blood pressure. And again, if you have not emptied your bladder. So it's very important that you let your healthcare provider, the person taking blood pressure, know what medications you're taking and whether you've taken caffeine or not, and that you've rested for at least 5 minutes before they take your blood pressure. So I will talk now about the risks that predisposes you to or contributes to you having high blood pressure, and some of them are modifiable, some of them are not. but there is always something you can do to either prevent it, control it, or actually reverse it if you have it. And as people grow old, so we're looking at the risk factors now. As people grow old, they tend to have high blood pressure. So that's one of the things. Obviously, there's nothing you can do about the age, but some of the things will be showing up as, you know, lifestyle, because as you grow old, you accumulate bad habits, and those habits, whether it's eating habits or the fact that you've not been exercising for a long time. By the way, when we talk about exercising, we're not talking about you signing up to, you know, a certain gym. We're basically saying walking. I mean, you can literally go the whole day, whether you've been driving or you're on a, you know, public, whether it's public, private means or motorbike or whatever it is, you could go the whole day without walking much. Basically, from your house to some, you know, automobile to your office, you sit down the whole day. So you're thinking you're active, but actually you're not active. So basically, age will be a risk factor. So, but it doesn't mean that somebody cannot develop high blood pressure when they are young, about, you know, 18-year-old. And we're talking about these numbers, by the way, we're talking about, you know, an adult, an 18-year-old and over. The other risk would be family history. And you know, that means if you can find that in a certain family, there are certain, you know, there are things that are genetic, that they are in the family. But I would like to mention here that sometimes we say that it runs in the family, but it might be running in that family not necessarily because of genetics, but because basically the habits in that family that have been passed from generation to generation, meaning how they eat and how whether they exercise or not. So basically it will be running in that family because probably of the way they cook or where they eat. So I mean, that is something that can be modified. Being overweight or obese will contribute into having somebody having high blood pressure. And we talk about being overweight. We're talking about BMI, which is body mass index, being above 25. And they, you know, you don't need to cram how to measure BMI. You can just go to Google and type BMI calculator, and it will give you, you know, you just need to know what is your weight and what is your weight and height, and basically put those numbers and it will tell you your BMI. And your BMI, if it's above 25, that means you're overweight. And if it's above 30, it means you're actually obese. And so very easy to, you know whether you're overweight or not. That's going to be contributing whether you have high blood pressure or not. And if it's not here now, eventually those are things that will, you know, cause you to develop high blood pressure. Too much salt or sodium, because sodium tells your kidney, don't retain the water in your body. And when water is retained within the pipes, the vascular system, it increases pressure, and, you know, and blood pressure goes up. And so if somebody takes too much salt, that becomes a problem, or too little potassium. But how would you even know that you're taking too little potassium? And that's why, you know, we keep emphasizing in healthcare the fruits and vegetables, because some of the things that you're going to be getting from your fruits. For example, oranges and bananas are high in potassium. So if you're already taking those, you're already taking sufficient, you know, dietary potassium. So why potassium? Because potassium, you know, helps to, you know, helps in the balance between sodium and potassium. So if you have too little potassium, that means you're going to be accumulating too much sodium, and so that, you know, there's a problem, and that's how you're going to be accumulating water, and water raises in your blood vessels will increase blood pressure. And that's not to say that you should not be drinking water. I'm just saying how sodium tells your kidney to retain water in your body. So other things like smoking, obviously smoking tells you, the smoking will temporarily raise your blood pressure as you're smoking, but there are chemicals in your blood that will actually start making the walls of your artery, the pipes, to get narrower, to contributing them getting narrower, and that basically raises blood pressure. The other thing is stress, and stress basically makes your blood vessels squeeze, and that squeezing or constriction causes your blood pressure to be high. So if somebody is continually or permanently, in long term they are stressed, then their blood pressure is, you know, will constantly be high. And if it's constantly high, that means that there are certain things that we've talked previously that are getting damaged, or how the body internally is modifying itself as a result of that blood pressure or high blood pressure. And but you can change that by changing how you cope with life. And so there are life coping mechanisms. And one of the things to avoid, because when people are stressed, they're people who eat too much, and obviously that contributes into being overweight and obese, and therefore high blood pressure and other issues along the road. Or they drink alcohol, and actually alcohol is one of the things that also drinking too much alcohol contributes in high blood pressure. But in terms of managing stress, the people who either will drink alcohol, eat too much, or smoke, and those are things actually really, making an already bad situation worse instead of helping yourself. So those are things that you would watch out for, and you can modify to make sure that you do not have or develop high blood pressure. But I should also mention here that if you already have high blood pressure, it doesn't mean that that's the end of the road. You work with your physician or your healthcare provider to work on a plan to control it with both medication, diet, and exercise. And there's a place, there are people who will, follow a certain regimen in terms of medication, in terms of exercise. And again, I have to emphasize here, exercise doesn't mean joining a gym. I told you, in a previous episode that this guy had high blood pressure when he was 20, and all he did was, walking, running, skating, riding his bike. And actually, before I came to this program today, I just came from riding a bike. Why? Because I know I can develop high blood pressure. So I watch how I live in terms of what I eat and how exercise. So basically, it doesn't mean that you need to join a gym. It just means that you need to be active. And when your body is active, for at least, and when we say active, that means walking briskly. You feel like you're kind of, panting or running out of breath for about 30 minutes, 3 to 4 times a week. That's what we're talking about. So we're not talking about joining the gym and and stuff like that. And if you can join the gym, there is no problem with that. I'm just saying that's when we're saying exercise, doesn't mean that you need to have a trainer. It just basically means walking and riding your bike and running if you can. But again, if you already have high blood pressure, you need to coordinate that with your physician or with your healthcare provider, because you can put yourself at risk by doing certain things that you that have to be. You have to have medical advice before you do certain things if you already have high blood pressure. So that concludes the presentation for the day. But it is important that, again, you remember that high blood pressure is, there are no symptoms for high blood pressure. The only way to know is by having it measured. And we've said that there are certain things you have to make sure are in place, to make sure that there is no misdiagnosis of high blood pressure. And what are the risks that exposes you to high blood pressure? And if you do not know what is your blood pressure, and let's say you have high blood pressure and there is no way of knowing unless it's measured, eventually there are certain things that will be happening. And I want you to go back to the clips, because we've talked about how you can have medical emergencies where you have internal bleeding in your brain or in your abdomen, and the medical emergencies, if you're not here anywhere near a hospital, basically that can be the end, or where you have your pipes narrowing as a result of high blood pressure, and you end up having organs that are not receiving appropriate amount of oxygen, and they end up dying. We call it ischemia, and they're dying again because of what? High blood pressure. Or you end up having an enlarged heart which cannot pump, and we've talked about this. So go back to some of the clips that we've talked about, and you realize just how dangerous blood pressure can be when it's not treated, and the reason as to why it's called the silent killer. So we hope, please give us feedback. We hope some of the clips have helped you to modify your life and to seek to know what you can do in order either to control, prevent, or reverse high blood pressure. And if you're doing that, then we know that we are doing our work. So we've already talked about all these things. And lastly, if you like what we are doing, you can look at Amazon.com at a book written by this guy, Robert Mwangi, and give us feedback. Let us know what you are doing as a result of what we are teaching. Again, for now, my name is Robert, and thank you for watching. Adios.